Hello, everyone. Let us just wait for a couple more minutes to allow other participants to join us. Then we will start with the program. Thanks for your patience. Ladies and gentlemen, warm greetings and welcome to the third out of five webinars organized by the Washington Schools Network. The session for today is entitled WinS Monitoring Innovation, Applying Digital Tools for Washington Schools M&E. If you have been to any or both of the first two sessions we've had so far, welcome back and thanks for joining us once again. Please be reminded that this session is going to be recorded and made available via the WINS Network website. And by staying on the call, we understand that you provide your consent to this. I am Margaret Lim of the WINS Network Secretariat, and I have the pleasure of opening the session for today with a brief introduction of the WINS Network. I'm also joined by my colleagues Frederick Madrid and Piata Mendova, who are strongly supporting the coordination and preparation for this event. Over the next hour and a half, you may see either of us posting in the chat. So yeah, please tune in and feel free to post the country where you're currently located and the organization you're working with. So at this moment, please allow me to take a few minutes to introduce the WINS Network and to provide an overview of the webinar series. So the WINS Network is a global interagency network that is working towards the improvement of WASH services in schools across the globe. In order to do that, the network facilitates exchange of experiences and alignment of strategies among various organizations in support of government's Wash in Schools program. The network is steered by the core group members, which you see their logos on the screen, namely UNICEF, JZ, Save the Children, WaterAid, the WHO UNICEF Joint Monitoring Program, London School of Hygiene and Tropical Medicine, Emory University, and UNESCO. WINS network activities are focused on the working streams, which are also on the screen, and I will read out since apologies if the font size is quite small. So these includes advocacy, policy and system strengthening, monitoring and reporting, research and evidence building, gender including MHH, WINS programming, and knowledge management, capacity development, learning, and exchange. So if any of these initiatives is of interest to you or is aligned with the work you do, we cordially invite all of you to continue exchange with the WINS network, either as a member or a partner organization. What this means is that you will be part of our mailing list and you will receive regular updates on the WinS network activities. If there are events, there will also be calls for contribution, which are also not mandatory, but could, of course, be a platform to share best practices within your area of work. So basically, there is no active engagement required, but would, of course, be most welcome. You may check out the website winsnetwork.org. Again, that's winsnetwork.org for more information. On the website, you may also find upcoming and past events on WINS and a collection of relevant materials and information about WASH in schools, including global guidance documents or resources, publications in peer-reviewed journals, and a WASH in schools and COVID-19 knowledge map. If you have any question, please feel free to place them in the chat and we will address them as soon as we can. I will also post the link to the member registration form in case any of you would like to become a member of the WINS network. Next slide, please. At this point, I will now move on to the next segment and hand the virtual stage over to our session moderator. Please allow me to introduce Belinda Abraham, who will guide us through the informative and interactive session ahead of us. Belinda Abraham is an American national and international development specialist with over 25 years of experience in the WASH and education sectors in sub-Saharan Africa and Southeast Asia. She has worked with UNICEF, GIZ, and several international NGOs in 7 countries. Belinda is currently based in Berlin, Germany, supporting the Global WASH in Schools Secretariat and also supporting Viva Conagua, an institution fundraising for their projects in Africa and Asia. So without further delay, I now pass the virtual mic from Manila over to you, Belinda in Berlin. Thank you very much.
Hi, thank you, Marge. I hope it's sunny. I'm sure it's quite nice and sunny in the Philippines, and hopefully it's all beautiful weather wherever you are. Actually, looking through the chat box is great to see so many people from Cambodia and Priya and team from India. So great to see all of you from Zambia as well. Now, so glad to be here. I'm hoping we'll have a really nice interactive session. And actually, I don't know if, like you go to many of these webinars and you can only use the chat box. And we've heard the comments and people, we take them very, very seriously. And we would like to make this one a bit more interactive. So while we'll have the presentations, we will also open up the mic. So if you are interested in saying a question or speaking or sharing a comment, whatever it is, just put your hand up. I think the hand function should work. If it doesn't, then just type in comments. But we'd love to hear from you. We want this to be as interactive because we know there's a lot of great professionals who are listening. We have a great lineup of panelists today to share, and we'd love this to be exactly what it is, an exchange. So with that, again, welcome everybody. Would love to introduce our first presenter today. And it's a place which Cambodia is really, Roswell, I see that you're there. So it's something close to my heart, Cambodia. Would like to introduce Dr. Yung Kuntarit. He is the Deputy Director of School Health Department. And Dr. Yung Kuntarit is currently in the Ministry of Education, Youth, Sports for the Royal Government of Cambodia. And he has more than 20 years experience in health promotion in Cambodian schools. In fact, he just said that he's just coming from the province now. So he's a very, very busy man, but so we really appreciate that he could join us today. He's also the key person in charge of the establishment of policies, regulations, strategies, operational plans related to school health and including health education. And he's been doing this since 1999. So Dr. Kuntarit will today speak to us a little bit about monitoring and data collection under the minimum requirement guideline in Washington schools. And as many of you know it's been a huge flagship program for Cambodia. And so we're really pleased for him to join us today. So Dr. Kuntarit, please, you are welcome.
Yes, thank you. Thank you, Belinda. Good afternoon from Cambodia for everyone. First of all, I would like to thank for the Belinda Abraham who inviting me to join this event. Today, I would like to share the implementation guideline on the minimum requirement on WASH in school in Cambodia. but because busy time, I don't have any PowerPoint presentation to show, but I will talk by my heart, by my experiences, I also by my knowledge. Yeah, thank you very much for attending this first presentation from my side. Uh, before starting to the main point, I would like to explain why we just only need minimum requirement. Why not in a national standard on what's in school in Cambodia? To answer this question, I would like to inform you that early 2010, the awards that are in Cambodia very limited and very poor data, are not showing so much on qualitative and quantitative data on water, sanitation, and hygiene in school. And this the only quantitative data on showing about the school without toilet, school without the hand washing facility, school with water without water supply, something like that. And we didn't have a how many school there were their toilet were functioning or usable for separate female and male, and also for the separate disability people to use, something like that. And realizing this situation, Ministry of Education, Youth and Sport, with the technical support from GIZ and UNICEF, try to introduce the minimum requirement uh, on WAS in school, and we established the new guideline called minimum requirement on water, sanitation, and hygiene in school since 2016. And this guideline also endorsed by minister, and also this guideline are focusing on main four category. First one is safe drinking water, second toilet and urinal, the third in hand washing facility, and the last point is for the safety environment in school. And we repeat totaling of 26 different variable. We focusing on the quantitative and qualitative measurement rankings, star ranking from school with 0 star and star 1, star 2, and star 3, with adapting of the 3-star approach of the UNICEF and GIZ initiative. After endorsement of this document, Ministry of Education, Youth and Sports started to piloting in this guideline in some provinces under support from development partner, for mainly UNICEF and GIZ and World Food Program. After that time, we try to build the capacity for school principal or school director, especially school management committee, to do the school self-assessment on water, sanitation, sanitation and hygiene in school with all variable, and we use the both paperwork and digital platform use called Kobo system under support from GIZ and under support from UNICEF and WAP. And then from 2018, the ministry tried to start to implement the whole country, the country-wide, with all schools in Cambodia using the same this data to collecting data, all schooling from preschool, primary, lower secondary, and upper secondary, uh, uh, using the image system. We try to introduce the all variable, all data, collecting data from minimum requirement through a MIS system, education management information system, one times a year. Uh, and right now we just like a compulsory work for the school level. We from the data collection, analysis, and use of the data. I would like to inform you that the data of the minimum requirement has been used by school level to make sure that they can uh, see what work, what doesn't work at the school level using the all variable finding from the minimum requirement. And then the district and provincial level as also used for advocate and mobilize resources from their under their own responsibility. For my department, I think it's very useful using the all data to mobilize resources from Ministry of Economic and Finance and also for the development partner to support any finding from the minimum requirement on WAS. And to frankly speaking, at the beginning of this establishment in Cambodia, the nearly 50% of school without toilet, without hand washing facility, and without clean water supply, and also more than 35% of the school without toilet. But right now we can see under the using the data, the qualitative and quantitative data from the of the minimum requirement, we can improve a lot of the star ranking. Starting from the 2016, there was the uh, there was 68% of the school with uh, at least 1 star to the 3-star ranking. Until right now, 2022, there are 82% of the school in Cambodia ranking star 1 from 2 star 3. It's a huge development improvement. And also, I would like to show that to mention that this data is very interesting for the government, like to invest more budget from 2016 until now. There are at least 360 schools with the support from the government budget to build a toilet, to build a water supply and facility, and also hand washing facility. These are kind of the support, and also the using the data to make sure that the school level can improve themselves without step by step, year by year. It's not jump from the one to another. It's the effort from the school level, and the government, central government, try to use data to support any kind of the evidence base for make sure that the the budget will release from the national level to directly to bank account of the school level, and the school level can manage the fund to improve the status of what in school using their own responsibility and accountability. That's all. It's my presentation. Thank you very much for your attention, and any welcome for any comment and questions. Thank you very much, Belinda, and all audience. Thank you very much.
Wow, that was really well said, and chock-packed with a lot of information for us. I think one of the things I took from it, besides how you explained the system, but what a jump in actual, first the schools participating in the system, but also the jump in actual improvement in school. And that you also talked very clearly about the various levels, what it made it schools being able to, through the monitoring, being able to make doable actions themselves, the districts being able to use it as advocacy, and at national central level being able to use it for resource mobilization. And so it's been, as you said, it's been a step-by-step process. So very, very impressive. Now it's actually open for questions. It's fantastic that you were able to sum it up so beautifully, and so really a lot of information for all of us. I do also want to acknowledge that Ministry of Education and Health in Kenya are also listening, so you are welcome. Thank you, Agnes, to ask any questions. You can open the mics or raise your hand if you want to ask a question. And maybe as we're looking in the box for questions, I wanted to ask you a question about how do you manage like the data quality? How do you do quality assurance from the data that people are not just reporting different things, and at the end of the day, how do you know that the data is there? What methods do you use?
Yes, thank you very much for the question from Belinda. And the data we collect by the school level using the discussion between the school support committee together with teacher and also community together to do the checklist and self-assessment. And then they try to analyze by using the hard and also the computerized by district level and sent to the provincial level and analyzed by all level, example for the school level, district levels, provincial level, and national level to analyze it and using analysis. But the question the qualify of the data, we found that the after we cross check the by a professional like GIZ and UNICEF together with the school head department, we found that less than 10% error, less than 10%,
Oh,
but
wow.
mostly more than 90% is correct by just scoring and putting the number and also the checklist very properly by school level. I think very
Mm.
important part that we after we cross check by our team from the together GIZ, UNICEF and school head department. Thank you very much.
Oh, great. So less than 10% actually you found errors. So that's pretty amazing. I think linked to that, Roswell has a question about the data. So he said, I'm familiar with the paper-based WinS minimum standards questionnaire. Can you share the way the data is being collected digitally? You did make a little bit of mention about the computer-based and that. Can you share a little bit how the data is being collected digitally?
Actually, the first beginning, the first quarter, especially the first month of the a new academic year coming, the school level discussing with the school director, school principal, and school support committee and teacher together with the school the community around the school and the level, the status of the media of the any variable, yes or no, based on their real practice in the real situation, because in the data of the minimum requirement, not focusing on quality quantity but also quality. It means that every variable we just putting the functioning or functioning toilet or usable hand washing facility, something like that, and the clear definition on each variable to make sure that the all school principals, school director are very well understand about the how before putting yes or no, something like that. So and that
Mm-hmm.
the this data also can using Kobo system, use Kobo platform, and also together with the like Excel sheet to send to the district level, and both of the hard copy and soft copy the same figure, the same answer, something like that, and
I
send
see.
sent to provincial level and sent to the national level to analyze, and we can show the result on the Congress of Education every year, and
Okay.
this discussion among AMIS department and my department and other relevant department to discuss further how the data is correct or not correct, something like that, and we can find the way to consolidate together at the national level. Thank you.
Yeah, good. So you made a mention this. So they have the option to do a paper base, but they can also use the Kobo toolbox through their mobile phones. And it's collected from the various levels, so up to district, province, then province up to national level. And it's at the time of the Congress, of which the annual Congress, where the data is actually presented, some sort of roundup and presented. And so this is very interesting. Linked to this, actually, Agnes is just asking, but Alex has shared with it, the minimum requirements. If you can just highlight briefly what it is and how you have integrated it into the EMIS. And then she's also asking about the frequency of data collection, but I think you've asked that already. So just if you can maybe just briefly explain how is the minimum, like how would you describe it? For those. And Agnes is actually from UNICEF, but she's also representing the group of them from Kenya. So the Kenyans are very interested in the Cambodian minimum package. Yeah.
Yeah, for sure. The every academic year, the school level need to the data entry for collecting data, all figure like environment, the enrollment rate, something, the how many school teacher, how many all kind of the indicator, but also wash minimum requirement on wash with 26 variable is part of the data collection at school level. It's part
Hmm.
of the compulsory work of the school level
So the
every
school census, like.
yeah, starting from 2018 until now. There are 4 years already for making the national system to collection, analyze, and also use the data together. Yeah. So it means that we also we experience this with 4 years already, and school level know very well about how to collection data, how to analyze the data, and how to use the data at the school level. And the very important part is translate the data, using the data to make improvement their own resources, using their own resources at school level, and also finding the new funding from the other resources to
Hmm.
support any kind of the school cannot afford to do something at the school level. It's a
Hmm.
kind of the implementation, and the actually we use the paperwork, but the paperwork together with the digital work is doing the same time, because the
Hmm.
government try to use the digital, introduce the digital is a part of the usual daily work of the government after the COVID-19 2 year COVID-19. And we can experiencing how to use the digital system. Beyond that, I would like to inform that because of the COVID, maybe the opportunity that government of Cambodia, as Ministry of Education and Sport, maybe the 10 years before the the goal of 2030. It means that we already know how to use the
Hmm.
digital by
Hmm.
school level, and also
Hmm.
the government central and district level and
Hmm.
provincial level. It's a kind of opportunity that we
Hmm.
during the COVID-19, during 2 years of COVID-19. Thank you.
Thank you very much. And just the last question, I've missed it already, but they were was a question from Heng, and Heng was asking about the threshold. What is the school and wash threshold? That was the question.
What does it mean, the ratio of the
Yeah,
use?
threshold. He had asked. Um, he said, "Thank you. What is the threshold for wash in schools?" So I guess maybe threshold being what is the national standard or the expectation for wash in schools. I guess that's maybe unless yeah, that's how I understand it. Like what is the or no, sorry, what is the minimum, I guess, threshold? I don't know if the threshold is what is the minimum that schools are supposed to have? I think maybe that
Yeah.
let's start with that.
Uh, thank you very much. The minimum mean that we ranking the star 0 and star 1, star 2, star 3. The ranking the star 1 is we call minimum rate,
Mhm.
minimum ranking, and star 2 is the more advanced, and the star 3 it means that national standard, something like that,
Oh,
and
okay.
so it means that right now more than 82% of school in Cambodia meet the minimum requirement. I
Hmm. Hmm.
just
Which would
so
be bringing water to school, toilets, segregated toilets, and then hand washing facility. Do you have MHM with that, or is it just
yeah, include everything, include
okay?
MHM, include
Hmm.
water management, waste management,
Okay, waste
including
management.
hand washing, toilet, urinal, and separate for the disability toilet, something like that.
Okay, perfect. And also, we've shared the minimum requirements. So if anybody wants to get it, you can click it there. It's in English. So Akuncharan again,
Thank you.
yeah, Excellency. Thank you so much for your time today. And I know you're super busy, but I think it's really helped all of us to learn a little bit more. And I do want to congratulate Cambodia on the great work because I was there from 2011 to 2015, and I just see it goes strength by strength. So congratulations on the good work. Keep it up. And thank you so much for joining us this morning,
Thank you.
this
Thank
afternoon.
you.
Thank you. Great. So then, thank you. So now we will move to the next. And you can just hold your questions, then we can invite for the next. Great. So I am very pleased to invite Dr. Manik. He is a a statistician from Madra Experts, which is a coordinator substance data and statistic education at Indonesia's Ministry of Education, Culture, Research, and Technology. He graduated with a bachelor's degree in statistics from the University of Gajah Mada Yogyakarta, Yogyakarta, and he has earned his master's degree in geography, specializing in spatial planning from the Universitas Indonesia Jakarta. And today he's going to be doing a beautiful presentation in the beautiful language of Bahasa Indonesian. And we are pleased to have a translator. His presentation will be in English. The PowerPoint will be in English. He will speak in his beautiful language of Bahasa Indonesian, and we will have it translated afterwards. Once again, if you have questions on the chat box, but you can also please have your hands, and we can also take the questions when the session comes. So over to you. Thank you very much.
Yeah, thank you, Belinda. Good afternoon. Good afternoon, everybody.
Thank you.
Ladies
Good
and gentlemen. Yeah, I will to present with Bahasa Indonesia, and Miss Ayu will be help me to translate our presentation. Yeah. Kami akan mempresentasikan terkait dengan pendidikan dan kesehatan terkait dengan akses. Bahwa pendidikan dan kesehatan ini merupakan suatu kebutuhan dasar pada setiap manusia yang harus dipastikan di dalam hal implementasi di lapangan. Slide berikutnya.
Saya terjemahkan ya, Pak.
Oh ya, oke. Sorry.
Good afternoon, everyone. Today, I'm going to present about education and health access in Indonesia. As we know, education and health are basic needs for human, and this needs to be, the implementation of it need to be really considered. Silakan, Bapak.
Oke, untuk gambaran pertama, ini adalah gambaran tentang pendidikan di Indonesia, di mana kita bisa lihat bahwa jumlah sekolah di seluruh Indonesia dari Sabang sampai Merauke ini kurang lebih ada 437.221, kemudian siswanya kurang lebih sekitar 52 juta siswa, kemudian gurunya kurang lebih sekitar 4.200.000. Tetapi bahwa data yang kami paparkan ini belum termasuk dari pendidikan di bawah pembinaan keagamaan, kurang lebih sekitar 120 sekolah, 120.000 sekolah.
So this is the preview of education units in Indonesia. At the moment, we have about 437,221 education units, about 52,150,603 students, and 4,189,727 teachers and administrators. However, this numbers doesn't include religious schools, which is about 120,000. Silakan, Bapak.
Slide-nya terlambat. Maaf. Oke. Sebelum Nah, untuk mengintegrasikan bagaimana pendidikan kesehatan dari sisi akses, tentu ada hal-hal yang perlu kita lakukan. Yang pertama adalah harus berangkat dari kebijakan yang terintegrasi. Nah, kebijakan terintegrasi harus berangkat dari informasi yang terintegrasi. Informasi yang terintegrasi ini harus berangkat dari data yang terintegrasi juga. Nah, agar data terintegrasi, syaratnya harus menggunakan satu referensi. Jadi, pada saat kita mengintegrasikan kebijakan di level implementasi antara kesehatan dan pendidikan, tidak bisa berjalan dengan baik jika tidak merangkat dari data yang sudah terintegrasi. Maka langkah pertama yang harus kita lakukan adalah bagaimana kita mengintegrasikan data pendidikan dan kesehatan agar bisa mengintegrasikan kebijakan di level implementasi. Silakan, Mbak.
So to integrate education and health access, we need an integrated policy. And to have an integrated policy, we need integrated information. And to have integrated information, we need integrated data. And this integrated data can only happen under the condition that we have one reference in which the policy and the integrations comes together in the implementation of it.
Untuk satuan pendidikan dan satuan kesehatan, ini dari sisi fungsi layanan dan pembinaan, ini ada dua hal yang bisa kita lihat. Pada saat kita bicara satuan pendidikan di level pendidikan, ada dua fungsi. Yang pertama adalah fungsi layanan, di mana fungsi layanan kepada warganya. Kemudian fungsi pembinaan. Fungsi pembinaan di sini adalah membina anak-anak yang ada di dalam sistem pendidikan. Itu dari sektor pendidikan. Kalau kita bicara sektor kesehatan, ini mempunyai hierarki dari mulai puskesmas. Puskesmas adalah pusat kesehatan di level kecamatan, subdistrik. Nah, di mana puskesmas ini mempunyai fungsi dari monitoring, evaluasi, dan melakukan kurasi tentang kesehatan. Sedangkan UKS adalah bagian dari satuan pendidikan tersebut. Jadi di level mikro, ya, di level mikro pada level implementasi di sini, peran satuan pendidikan dan puskesmas harus terintegrasi dalam hal program di mana puskesmas mempunyai fungsi monitoring dan kurasi, UKS dari sisi fungsi pembinaan atau fungsi kepastian kesehatan dari anak didiknya.
So let's have a look now at the education and health units. When we look at the educational units, there are two functions. The first one is the service functions, is to give service for every citizen for education, and the coaching functions, in which the education units is giving coaching for the community to develop potential through learning process. Now, when we look at the health units, there are different hierarchy if we see here. So the first one is what is called Puskesmas. This is the central of health services. And on the sub-district level, they have three functions here. The first one is health monitoring and evaluation, two functions. And the second one is health curation. And what we call in Indonesia as UKS, or the unit of health at school, is a part of the health unit in schools. So this education and health unit need to be integrated in its function. Silakan Bapak.
Ini merupakan gambaran bagaimana kami di Kemendikbudristek, Kementerian Pendidikan dan Riset dan Teknologi mengelola data, di mana bahwa yang kita bangun adalah data induk pendidikan. Data induk pendidikan ini tergambar di nomor 4, merupakan gabungan dari 3 sumber data. Yang pertama adalah Dapodik. Dapodik adalah mekanisme pengumpulan data dari pendidikan dasar dan PAUD di bawah Kemendikbudristek. Sedangkan PD Dikti adalah mekanisme pengumpulan data dari pendidikan tinggi, sedangkan EMIS adalah mekanisme pengumpulan data dari sekolah di bawah Kementerian Agama. Dari 3 sumber data ini kita integrasikan di dalam data induk pendidikan. Kemudian data induk pendidikan ini digunakan untuk internal dan eksternal. Kalau yang nomor 6 ini adalah internal kementerian, artinya bahwa semua program pembangunan terkait dengan pendidikan harus berangkat dari data induk pendidikan. Sedangkan poin 5 ini adalah eksternal yang menggunakan data pendidikan, termasuk Kemenkes, Kementerian Kesehatan tadi. Nah, konsep konfigurasi pembangunan data collecting ini kami di Indonesia sejak tahun 2011 mekanismenya sudah on system. Jadi sekolah mengentry data, kemudian data itu langsung ke pusat, tidak melalui distrik atau provinsi, terus ke pusat tidak, tetapi dari sekolah, dari satuan pendidikan langsung ke pusat. Nah, kemudian tahun 2020 mulai kami integrasikan dengan Kementerian Kesehatan terkait dengan vaksin, imunisasi, kemudian sanitasi itu. Nah, untuk tahun ini kita mulai mendetailkan kegiatan-kegiatan yang terintegrasi di 2 provinsi, ya, itu di Provinsi Papua dan Provinsi Banten dengan GIZ, kemudian ada UNICEF. Ya. Bagaimana kita mencoba mengintegrasikan implementasi kebijakan di level satuan pendidikan dan puskesmas. Silakan Mbak Ayu.
So what you see here is a preview of that we have created from the Ministry of Education, Research and Technology. As you can see here, this is how we manage the data. The data that we have is gathered together in the education big data. There are 3 mechanisms here. The first one is what we call DAPODIC. DAPODIC is the mechanism of data collection from the basic education up to the high school. And then what we call PD-Dikti is the mechanism of data collection for higher education. And EMIS is the data mechanism for data collection from the Ministry of Religion. Educational big data is then it goes into the internal and external system. For number 6, as you see here, is the internal integration. This is what we use in the ministry. And for number 5, external integration is the data that is being used by other ministries, such as the Ministry of Health. In Indonesia, since 2011, the mechanism of our data system has been centralized. So school will enter data and it will go directly to the national level. So it doesn't have to go through the provincial level or regional level, but the data from each school will go directly to the national level. Since 2022, we have integrated our data with the Ministry of Health. So the data will also include the data on vaccinations, immunization, and sanitations. And since 2022, we have also integrated the data into provinces, Papua and Banten. And we work together with GIZ and also UNICEF and in implementing policy in health and educational access. Silakan Bapak.
Slide berikutnya. Nah, ini contoh-contoh hasil integrasi kami yang kami coba tampilkan. Dari situ kita bisa melihat toilet yang layak, yang dibersihkan setiap hari ada berapa persen, kemudian ada sarana cuci tangan pakai sabun berapa persen, kemudian mampu mengakses fasilitas pelayanan kesehatan seperti puskesmas, klinik, rumah sakit, itu berapa persen, memiliki tim satuan tugas penanganan COVID-19 tingkat satuan pendidikan, ada berapa persen, ini kita tahu semua. Artinya dengan mengintegrasikan data di level grassroots, artinya di level satuan pendidikan dan kesehatan sebagai kurasinya, ini akan memudahkan untuk memonitor bagaimana kondisi pada setiap sekolah. Tentu butuh suatu mekanisme untuk verifikasi validasi. Maka pada saat proses verifikasi validasi, kita bangun yang dinamakan dengan ekosistem, semua harus terlibat di dalam hal kontrol dari data tersebut. Maka kita susun suatu dashboard bersama supaya nanti bisa saling mengkoreksi. Lanjut.
So this is an example of our integration. As you can see here, we can then have data on, for example, how many schools have basic toilet access with daily routine cleanliness, how many schools have wash facilities with running water or hand sanitizer, how many schools have disinfectant, how many schools have ability to access healthcare facilities such as puskesmas, clinic, hospitals, etc. So integrating the data on the level of educational and health unit have been able to help monitor the situation in each school. This then need mechanism for validation and verifications, which is why then we develop a system called the dashboard so everyone can monitor what's going on and support each other. Silakan Bapak.
Ya. Nah, ini contoh dashboard yang kami gunakan untuk mengontrol bersama. Bersama artinya pusat, provinsi, kabupaten, sampai sekolah, atau antar kementerian, bagaimana profil sanitasi sekolahnya, kemudian ada indikator-indikator SDGs, kemudian kami buat dashboard dalam bentuk spasial untuk memudahkan melihat bagaimana dari sekolah itu apakah terletak daerah remote dan segala macam, nanti akan mudah untuk melihat kondisi di sekitarnya, maka pada saat menyusun suatu kebijakan atau intervensi itu tepat sasaran.
So this is the example of the dashboard that we have created so that different parties can monitor how it has been running. So the national level, provincial levels, and also the regional governments can see how this has been going, and also the schools or different ministries. Here we can also, for example, see the profile of the school sanitation in each year, and we can have a look at the SDG indicators. We can also see the special indicators to see whether the school is located in remote areas, which will provide information if intervention is needed. Silakan, Pak.
Sementara itu yang bisa kami sampaikan. Terima kasih waktu dan tempatnya. Saya kembalikan ke Mr. Belinda. Terima kasih, Mbak Ayu.
Ya, Pak Ayu, terima kasih. Thank you so much. So please just stay on. I think we'll have lots of questions for you, but I must say my reflection on the presentation, one, very well done. Amazing. When I look at the numbers of schools we're talking about in Indonesia, really congratulations. When even just, I think public primary schools is over 150,000, never mind all the community learning centers and so forth. So one thing that came from your presentation for me was the need for those institutional arrangements to make sure that that the different parties and levels are working together. But speaking maybe specifically, please, people, you're welcome to put your questions in the chat box or raise your hand. In the meantime, I will post a few questions to you. So a couple of things that come to me when you've got such a big system, you've got so many people, involved at various levels. Although you did mention that the data comes from the school directly to the national level, so it doesn't go through all the steps. How do you ensure the quality of the data? How do you ensure the quality of the data when you have so many schools, so many, and it's coming directly to you? You don't have that system of triangulation like other countries have, where they go through the districts and they check it, and then they go to the provinces and check it. In your case, it goes directly. So how do you manage the data quality?
Yeah, thank you very much. Ya, pertama yang harus kita lakukan adalah integrasi dan menggunakan satu referensi. Maka di setiap satuan pendidikan kita kasih satu ID dan itu digunakan untuk semua program. Entah itu di Kementerian Pendidikan, entah itu di Kementerian Kesehatan. Maka data itu akan otomatis akan terintegrasi karena tadi menggunakan satu referensi di dalam satu mekanisme. Dan itu kita mulai tahun 2011. Silakan Mbak Ayu.
So yes, good question. The first one is integration and the use of one reference. So each education unit is given one ID. So this will be used for any data submitted to the Ministry of Education or the Ministry of Health. This way, all data is integrated, and we have implemented this since 2011. Silakan Bapak.
Okay, so then I guess related to that then, so the data is integrated, it appears in a dashboard so everybody can see it. How has that system helped to actually make changes in the school? So can you give us a little bit about, I think there was a few slides on it, the changes since having this system, since having the transparency of the system, how has it improved or changed or influenced the Washington school situation? Because at the end of the day, that's what we want. So, what are some of the changes you see?
Ya, thank you very much, Belinda. Jadi pada saat kami membangun ekosistem data itu berbasis transaksional, yang artinya adalah semua program pembangunan itu harus berangkat dari data yang sama dan betul. Dan ini yang akan mendorong setiap satuan pendidikan untuk mengupdate datanya. Jadi kalau datanya belum betul, maka harus dibetulkan dulu baru mendapat program. Dan ini terus berjalan. Gitu. Mbak Ayu. Ya.
Thank you very much. So the data ecosystem is built on a transactional base, which means that the accuracy of the data is highly important. We always ask each educational unit to update the data. If the data is not updated, then the data is not accurate. So this doesn't work. So data accuracy is the key here. Silakan Bapak.
Cukup? Ya.
I think that's all the response from me for this question.
Oh, okay. So, but in terms of, have you seen, so accuracy of the data, but have we been able to see changes and improvements as you look at the data when you look back at it? Perhaps maybe that was on a slide and I might have, but maybe just to reiterate, through this system, has it improved the situation? Do we see improvements in the situation?
Jadi melalui, saya terjemahkan Bapak?
Ya, boleh. Supaya...
Baik. Jadi melalui apa yang Bapak tekankan bahwa akurasi data ini, ketepatan data sangat penting, dan ekosistem yang berdasarkan transaksional base kan gitu Pak. Dari sistem yang Bapak terapkan ini, apakah Bapak sudah melihat perubahan atau peningkatan di sekolah?
Ya, kalau peningkatan di sekolah tentu kuncinya adalah tepat sasaran. Artinya adalah pembangunan itu pasti akan tepat sasaran karena apa? Data itu ada karena data semakin valid, maka pembangunnya akan tepat sasaran, Pak. Jadi sebenarnya adalah kata kuncinya adalah bagaimana segala satu pembangunan itu terkendali dengan suatu mekanisme data sehingga intervensi itu tepat sasaran. Maka perubahan itu pasti ada.
Itu pertanyaan beliau, Pak. Apakah perubahan apa yang sudah Bapak lihat setelah menerapkan ini?
Ya, program bangun contoh adalah DAK. DAK itu bantuan untuk sarana prasarana sanitasi. Misalkan. Jadi akan tahu bahwa sekolah ini memang fungsi sanitasinya belum lengkap, maka sekolah itu perlu diintervensi sanitasinya. Seperti itu, Mbak.
Yeah. So as I have mentioned again, the accuracy of data is very important to plan the intervention and what's needed. For example, because we have the data, then we're able to launch the program. There's a program that's called BAK, that's Assistant for Sanitation Infrastructure. Because of that data, we are able to implement correct intervention needed. So we have seen the progress.
So it's very much a planning tool as well for the government to be able to put investment. It's interesting question. I mean, Bella, do you want to unmute? This is open mic. I mean, Bella has a question, but Bella would love to see and hear from you. Your question, maybe you want to unmute? We have time. And
Yes.
I love us to have an interactive discussion. And not only do I welcome Bella, I welcome others. Feel free to share your questions and insights. It's a super interesting presentation. Please, Bella.
Yeah, just thank you very, very much for your interesting presentation. It's really amazing the amount of data which is there and also the way how you have the dashboards. Fantastic. The question is it really, how much is it used, on which level? For example, the availability of this data, the dashboards, are they being much used for looking or planning for example, for a whole district or a province? And the whole aspect of transparency, does it play a role in order to improve to improve WASH in schools? For example, do national, as I see right here, do national units like a province see the performance of other provinces? So that, and do districts see performance of other districts, see their own performance, but also the performance of other districts? So can they see how they are perform in relation to other parts and other units? So
thank you, Bella. Great. So maybe yeah, okay, go ahead.
Mbak Ayu bisa dibantu untuk
Baik,
saya takutnya salah.
baik Pak. Jadi selamat Pak, sangat menakjubkan data-data yang Bapak sampaikan dan juga presentasinya dan juga contoh-contoh dashboard yang sudah Bapak sampaikan tadi. Pertanyaannya adalah, satu, seberapa sering ini dipakai di setiap level, baik di misalnya di provinsi, di kabupaten, di level nasional. Itu yang pertama. Yang kemudian, bagaimana ketersediaan data itu sendiri dan ketersediaan dashboard-nya? Apakah bisa diakses oleh misalnya kecamatan, kabupaten, apakah tersedia untuk siapapun yang ingin mengakses? Kemudian pertanyaan yang ketiga adalah transparansi. Apakah transparansi data ini berpengaruh pada peningkatan WASH, program WASH di sekolah? Dan kemudian yang keempat, apakah misalnya unit-unit seperti provinsi maupun kecamatan bisa melihat kinerja dari wilayah-wilayah yang lainnya? Demikian Pak pertanyaannya.
Iya. Oke, terima kasih Mbak. Jadi ada beberapa hal, tetapi intinya bahwa paling utama kita harus berangkat dari data yang sama. Itu yang pertama, data yang sama. Nah, data sama adalah antara provinsi, kabupaten, itu harus berangkat dari data yang sama. Maka data itu berangkat dari pusat dulu, baru diturunkan ke provinsi, ke kabupaten. Nah, kemudian masalah akses. Akses kalau di dalam datanya, itu semua provinsi mempunyai hak untuk akses. Tapi ada hal-hal yang bisa dilihat untuk publik. Jadi kita pisah antara public domain sama yang bukan publik. Kalau misalkan informasi terkait dengan sanitasi dan segala macam, ini sifatnya publik, publik bisa melihat. Gitu. Ya, anunya apa? Jadi kita klasifikasi mana yang publik, mana yang tidak. Yang jelas provinsi pasti bisa akses datanya. Kabupaten juga berangkat dari data yang sama. Nah, terkait dengan progres efek ke sanitasi, bahwa sekarang di program pemerintahan di kami, Mbak, itu ada DAK sanitasi, Mbak. DAK sanitasi itu adalah program nasional, ya, program nasional terkait dengan intervensi sanitasi, dan itu bisa berasal dari data tadi yang kita collect tadi, dari ekosistem data itu, Mbak.
So thank you very much. So the essence is the data. The data is foundation. When we have the data, in which the data is collected by the center, the national level, and this data would be delivered through the other levels, such as provinces or regional level. So national, as the center has the data, and it will be accessible by lower levels. In terms of access, each province has access to the data, so all provinces has the access. In terms of rights to access the data are classified to public domain and non-public domain. So data regarding sanitations, for example, is categorized into public domain, and this is accessible for publics. But there are other data which is non-accessible by public. In terms of questions for the impact to sanitation, at this moment, the sanitation program is one of the main program of the government. We have the sanitation intervention program nationally. And again, this is coming from the data. Our intervention comes from the data that we have. Thank you. Bapak, ada yang perlu ditambahkan?
Cukup, Mbak.
I think that's all the response to that question.
Thank you very much. We have, I will look in the chat box and read it. Maybe we can take just one more question in time. There is another question from Priya in India, so perhaps maybe you can take that one and reply to it in the chat. But I'll take this one from Bukhari. He says, or it states that the challenge in some African countries is related to coordination mechanisms between the different sectoral ministries for data collection, which can affect the reliability of the data. Which is a good point. My question, I would like to know from the doctor, how have you worked to guarantee the reliability of the data in your country? So again, yeah. And I think yours, it was very interesting because you say the data is integrated with health and education. So there's another question on reliability. I think if you want to say, yeah.
Okay.
Yeah.
Ya, silakan, Mbak.
Oke, Pak. Jadi terkait dengan data atau reliabilitas dari data tersebut, Bapak Magagi Bukhari menanyakan bahwa di beberapa negara Afrika, tantangannya adalah terkait dengan koordinasi dari mekanisme antara sektor-sektor kementerian yang berbeda, betul. Dan yang akan mempengaruhi seberapa data tersebut reliable. Pertanyaannya, bagaimana Bapak memastikan bahwa data yang Bapak miliki di negara Bapak itu terpercaya, reliable?
Oke, terima kasih. Jadi kita mulai tahun 2016 ada yang dinamakan Perpres One Map Policy. Keputusan Presiden menggunakan satu peta tahun 2016. 2019 ada Perpres One Data tahun 19. Semua harus merujuk kepada data induk nasional yang ditentukan oleh Presiden. Artinya semua sektor harus merujuk kepada data induk nasional, termasuk sektor pendidikan harus mengacu kepada data induk nasional. Jadi ada payung hukum yang kuat dari negara terkait dengan integrasi dan reliable tadi.
I will take you to 2016, where in that year our president has issued what is called a one map policy. And then in 2019, the president issued a regulation on one data. So this legal regulation asks us that all sectors, all ministries have to refer to the big national data, including also educational sectors. So this provides us with a strong legal references in that guarantee the reliability of our data. Ada yang mau ditambahkan, Bapak?
Cukup.
I think that's all.
Oh, terima kasih to both of you. Terima kasih. So thank you so much. There are a few more questions still on the chat box, really around the time it took for the process to set up the validation. So if you don't mind to take a minute to reply back to that. But I will want to say again, I'm very, very impressed with what Indonesia has been able to do over the years and to create such a system, which I really think a lot of inspiration for many of us watching this. And so I can congratulate and thank your team as well. And thank you for taking your time, busy schedule, to be with us this morning from the Pustatan. So thank you so much. And Ayu as well, thank you for excellent translation. It brings the way.
Pleasure.
Yeah,
Thank you very
thank
much.
you.
Makasih
So,
Mbak Ayu.
Sama-sama, Bapak.
Very nice. And thanks the whole team in Indonesia too for arranging this today. So now we move on now to the Philippines, the beautiful Philippines. And unfortunately, my language limitations are limited to say hi in the Philippines. So I would say hi in English. But I'm very pleased to invite today our speaker, Ibu. Ibo Pakis is an environmental engineer and is currently employed with GIZ-CIM as an integrated expert for the Center of Environmental Informatics of the University in the Philippines in Cebu, beautiful Cebu. He is also a member of the M&E team for the Regional Fit for Schools program, and he's most actively in the visualization and presentation of data. So Ibu, let's visualize the data and what's happening in the Philippines to share with us. Thank you and welcome.
Belinda, thanks for the introduction and thanks to the previous speakers. Let me see if I can share my screen. Just a second. Okay, I would like to go in a little bit more on the actual dashboards. I think we've seen before from Indonesia, already some examples and the power of dashboards. I would like to go a little bit more into that, and also how a dashboard is not the end of the pipeline, but it's really an integrated part of the whole system. Now, if we look at WinS in the Philippines, the WinS system is voluntary. So schools are voluntary to participate. And we have a process in which the schools gather their WinS data and they do that in an Excel sheet. And that is a self-assessment. So it's voluntary. They fill in a spreadsheet, and in that spreadsheet, they already get direct feedback by a number of calculations on how they are doing and whether or not they reach star levels. Validation, and that question comes back the whole time, is done by the school division offices. They look at the schools closely, they document, they visit, they observe. And then there is also a recognition effort. Schools get a seal of excellence if they reach the national standards for 3 years in a row. And actually, we are now working on the first round of that. And then, of course, that is something that really helps, the recognition, the translation. And marked in orange is the level where we are placing our dashboard at this point. Because I think it's good to organize or to realize that a dashboard is something that you use for frequently returning questions or for occurrences, because policies are changing, there are new needs coming up, because, well, who could foresee, for instance, the current pandemic? So the needs for data change. And with the dashboard, you can actually very well visualize and share what you can foresee but there are always other things coming up. And we planned to have this dashboard at the school division level. The school division is the lowest geographic unit from the DEPET in the Philippines, and they are the closest to the schools. We, DEPET and GIZ and the partners, we are developing our dashboards in Power BI, a Microsoft Business Intelligence program. A reason for that is that Microsoft and DEPET have a partnership. And we use Power BI for two things. For the ease of access, because with Power BI, we can actually make a dashboard and show it on the internet, show it with people, share it with people. A number of those dashboards are actually also available online right now. And the other thing is it's an easy way of visualizing. Before using Power BI, we used Excel, a number of sheets, a huge amount of prints that had to be shared and all. And the dashboard is just an easier way to visualize and to share data. What we have in this dashboard is the participation rate, and that's an important indicator, as I said, because the participation is voluntary. The overall 3-star rating. We have 5 crucial indicators, and in order for a school to reach a star level, any star level in the Philippines, they need to conform to those 5 crucial indicators. Then we have information on 5 major thematic areas: water, sanitation, hygiene, deworming, and health education. And in order to be able to dig a little bit deeper, we have 17 specific WinS scoring points. As I said, the dashboards are available for 4 years now, from 2017-18 to 2021. And the data collection period for 2021-22 is almost done right now. So I hope that soon we will also have the new dashboard for the latest information. The way the dashboard works is that you nicely can select your school level you are interested in. Next, you can select the region you are interested in, and with that, you can select one or more of the divisions. And one or more, you can also select one or more regions, and if you select all regions, you get the whole Philippines. The selection you made is always visible in the status line, and at the right-hand side of the page, you get an indication of the indicators that we have: participation, 3-star rows, crucial indicators, etc. So the moment you make your selection, you go to data. And here you can inspect your data. So in this case, we show all schools, so elementary and high school together, from region 2, from all divisions. And there, if you look at the graph in the center, the pie graph, in dark yellow, you can see that 55% of the schools here are complying, are participating, and 44% do not participate. And this particular page is a strong issue in increasing participation, because we have noticed that DEPET is very competitive, and no one wants to be left behind. So the moment we started publishing these data, sharing these data also at a national learning institute, suddenly divisions, and by that the regions, see how they are faring, and then suddenly, and being recognized for participation, doing well, suddenly no one wants to be left behind. So publishing and sharing these data is a huge stimulus for divisions to participate. And the nice thing is, if your schools are participating and doing well, your division is doing well. And if your divisions are doing well, your regions are doing well. So it's a whole top-down, bottom-up approach in which everyone is linked to each other. And one of the things that we have with our dashboards is that they are not static. We have changes. And what you can see at the left graph is that I circled part of it. One of the things that really shows the commitment is that the school divisions actually asked, like, can we see the actual school results? In the first versions, we did not do that. And their argumentation was, because if we want to improve, it's not enough to see how many % of our schools are participating or not. We actually need to know which schools we need to influence to participate. So that's why we added a little plus and minus button, so you can increase and see the school details. So the divisions have more leverage over the schools to influence and to see how things are going. Going to our crucial indicators, I mentioned before, there are 5 crucial indicators that any school has to comply to in order to reach a star level, which are safe drinking water, gender segregated toilets, group hand washing facilities with soap, daily group hand washing activities, and access to sanitary pads. And again, in the same color, dark yellow, You see how schools are, the percentage of schools are complying in light yellow, those that don't comply. And then you see that safe drinking water is doing very well, although this also includes the schools where kids bring their own water. But if you look at the third and the fourth one, then you can see that for the daily group hand washing activities, 64% of the schools comply. However, if you look to the group hand washing facilities with soap, only 30% or 29.6% actually do have group hand washing facilities. Maybe there is a disparity, maybe not, but this is a way where you can use your data and look into the data, how things are going. And in this page of the dashboard, if you click on the icons on top, you will be led to a next page where you can see in detail, again, by school division and by school, how they are doing. So we provide a quick overview, but also the way to drill down and to go into detail in your data. As is shown here, again, the graph, the overview by division level, and also the graph helps the divisions easy and the region easy to see which areas, geographic areas are doing well, which ones need more attention. And again, in the table left, you can click on Auto Plus and get all the details from all the schools. So this is really a powerful tool for the whole system to see how things are going and where attention is needed. Now, as I mentioned before, policies change, the world changes, and therefore also our dashboards need to change. After the pandemic started, there was more and more need on the infection prevention control related WinS indicators. So starting this year, we actually added a page in which we have not only the overall 3-star level and how much the schools are complying to their crucial indicators, but we also provide them now at school level information about how many students are there per water outlet for group hand washing facilities, hand washing facilities. How many students are there per toilet, or per functional toilet? What's the ratio? Do we have at the school level enough water for hand washing? Do we have soap? And a number of management parameters, like how sustainable are the WinS activities? Is WinS part of the school improvement planning? Are soap, cleaning materials and repairs, are they funded? Are they part of the government funding? Or are they part of the school funding? I forgot the actual name of the MOOE, but are they structurally part of school management? So is what we do, is it sustainable? And this tool, again, gives a great, of this page, gives you good insight in how schools are prepared for face-to-face opening. The next thing is that there is data, and easy to use data, actually generates requests for more data. Many schools in the Philippines need to have improvement or want to improve, but there is not always sufficient funding. The local government units, the municipalities in the Philippines, are also free to have a special education budget, which they can use to support the schools. So we are now working on a new dashboard, and this is a sneak preview, a first glimpse, in which you can select a municipality, and then in that municipality, actually check if drinking water is available, if it's safe and tested, if there is enough water for cleaning and hand washing, if there's a regular supply for soap. Does the school need the recommended ratio of students per outlet? And for this dashboard, we selected those items where a school can, where a municipality can help. So for instance, if there is no drinking water available, maybe the municipality can help to connect it to a water net. Or if the water is not tested, maybe they can help in testing the water. Maybe they can help in building more toilets. Up till now, it was quite difficult for schools and for municipalities to make the connection, for a school to really say what is needed for a municipality to inquire. And we hope that with this dashboard, we can make that step and bridge that gap between the needs from the schools and the possible supports from the municipalities. So once you start building dashboards, when you start with your transparency process, you start sharing your data, there will be more requests. Some lessons learned. First, transparency of performance triggers actions on the school ground and within the system. I think that's the real thing. If you, what to say, what's being measured is being done. And that is something that works not only on the school level, it works through the schools, divisions, the regional level. It's really a systems approach, and it really goes beyond the individual schools. Publishing data, and the recognitions of achievements really work. We see that by the way the dashboards are being used, the number of requests we get, but also how eager schools and divisions are, I would like to say, compete for the recognition. These dashboards support data-driven decision-making, and with that, a correct allocation of resources. Another thing is that the dashboards are, well, we have developed them, so we would like to say they are user-friendly, but the whole process of monitoring and evaluation, because it's a task on top of the school management, a task on top of the teaching activities of the schools, is something that user orientation is an ongoing process. And we have noticed that the past 2 years, with DEPET and GIZ, we've held a number of consultation meetings with the regions in relatively smaller groups, in which we answered all their questions, from contents about monitoring to how do I upload my data, I forgot my username password, how can I do this, everything. And we really feel that it has helped the participation rates of the schools, because there are no more hindrances in why you should not participate. And we see that for a voluntary process from when we started 4 years ago with a little over 60% in participation rates. Last year, we were almost at 93%, and we hope and we expect to go higher this year. So that means almost all the schools in the country are participating in a voluntary process. And I think that's immense. That's really, really wonderful. The next thing, policies are dynamic and dashboards should follow. Maybe the whole monitoring and evaluation process should follow. We are now in our 5th year, and we also see a demand, a wish from DEPET to review the policies. Are we still doing the right thing? Are we still collecting the right information? Should things be changed? One thing I already mentioned also before, use your dashboard for standard situations, but you always need additional analysis capacity to really answer those questions that come up in, well, quick politics, changes in the environment, changes in the world. But please keep it simple, especially if you start setting up your M&E process, if you start setting up your data, your database and your dashboards. It is easy to think whatever you can add, maybe we can use it later. But the experience leaves many times that data that you collect, because maybe you can use it later, often are not used. So keep it simple, start with what you have, and then maybe see later if there is a need, if you can expand. And at that, I would like to keep it for now. Thank you.
Excellent. Thank you so much. Beautiful. And you know what I was taking away from that presentation, Ivo, was that the power of a picture, the power of visualization. You know, there's a process of obviously collecting the data, going through the data, but when one can see it and see where you stand, as you say, you don't want to be left behind, how it just sends the system to another level. It just sends it to another level. And I really see this beautiful evolution of what the Philippines has been able to do, from having a very great system of collection and follow through now to visualizing, and then having the impact of visualization. So I guess within that, and I love the point you said, the healthy competition, as we will call it, that everybody wants to show. How do you, under that context of healthy competition, want to keep the quality of the data, make sure that the reporting is correct and not, you know, being a little bit exaggerated because it's being presented? I mean, that is the risk.
Yeah, exactly. That is a point. We have the self-monitoring systems, the self-assessment. So that's one thing, but the data from the schools are being assessed by the division. The division data are being assessed by the region. So that's one thing, that's one form of assessment. As I mentioned, we are also now at the point of awarding the first seals of excellence. And despite that there are some mechanisms in place for quality control, DEPET is also really going to visit the schools to really make sure that the documentation matches the situation on the ground. Another thing I think that is quite important, and it's never really said, I think, that way, but we have now 4 years of data. It's quite easy to manipulate your data for 1 year, but to consistently manipulate your data over 4 years is a lot more difficult. So you can imagine that if your school is doing well and suddenly you're falling back because you might be a little bit was it easier or no, more honest in answering, you fall back, it will be seen. So, but I think especially the combination of self-assessment, where you can see how you are doing, and then the checks and balances within the system are a main thing.
Fantastic. And I kind of a little bit drawn. I know there is one question from Roswell who wants some clarifications on the abbreviations, but perhaps you can put them on the chat. Yeah, he was also saying also any issue with those of us in the private sector, because this is the other thing too. Was the beautiful thing about a visualized dashboard and that it is available in a sort of a public domain, or is for the most part available. It allows private sector, social enterprises, others to use it. And I guess your question is then, any issues with those in the private sector using the data to help with sales targeting? Have you seen the data being used, because it's available to everybody, used in a way for something else? I don't know.
And good question. Well, first of all, we don't share the baseline data. Most of the indicators that we have are already aggregated, so that's one.
Okay.
Second is the data are available on the web through a DEPET website, so we go for that DEPET agrees. But if ever we work with private partners, we make sure we have the explicit approval of DEPET. The other thing that I showed, that's the sneak preview of that, we call it now the LGU dashboard, where LGUs or private partners can help in supporting the schools. Building the technology, building the dashboard is one thing. The difficult part is, how are we going to share this? Is this something that is going to be used by DEPET as an additional tool for the school directors to approach municipalities, or to approach private partners? Or, and that means keeping the data in-house. Or do we go the next part? Do we share this, for instance, through our Department of Interior and Local Government? Share this to the local government units and give them the opportunity to see, hey, we want to do something with the school, where can we support? Well, that's a discussion that is still ongoing. But I think that is a discussion at all levels that should be held, like in the moment. Because even within an organization within a ministry, I can imagine right now with the dashboards at an aggregated level, we share all the data. But I can also imagine especially the moment you give the option to drill through, that you might want to have mechanisms in place where you say, okay, the data from these schools are only available for the school or for the lowest unit on top of it, and the aggregated data are shown on a bigger level. Those are still discussions we're still working on.
Okay,
and
perfect.
It's a difficult part.
Yeah, for sure. So just with the last question, I will take, there's a few more for you on the chat, so look at that as we're closing. But there was a question from Agnes and in Kenya, so it's coming from the Ministry and Health, Ministry of Education, Health, and also Ministry of Water, who are watching in Kenya, Nakuru. Their question is around, you mentioned that it's voluntary, so schools voluntarily provide the data, which is great. But she was wondering, is there any, what's the question, around mandatory? Because it's a national data, she said, can it be made mandatory to get a national picture? So she was just, yeah, that's kind of her reflection.
Yeah. Okay.
And why is the collection? Why is it voluntary, and why is it? Because they were talking a little bit about trying to mandate it and enforce this, and so maybe you want to share your reflections on the voluntary versus mandatory to get a national picture. Thank you.
Okay, well, first on the why, I can't really answer on that. That's something that started way before I came into the program. That's one thing, but I'm quite sure we have people in the chat and we can answer that one. There are at this point steps going on to combine the WinS system with the official EBRS system. So that has and also to go towards a more digital form of data collection. And that has a number of advantages. For instance, right now a school has to enter all their data 2 times because the systems are separate. We hope that soon a school only will have to enter its school ID, and all the other pertinent data, like how many toilets are there, how many students, what's the address, will automatically be read from the system. That might be a little bit of a problem for schools with bad internet connection, but if the people go to the district offices, they can enter their data there. And in that case, there will be a close link between the official data and the WinS data. In how much That also means that the WinS system will be mandatory or remain voluntary is something I think is still under discussion. I have no definite answer on that. Advantage of a mandatory system is that people will always answer because it's mandatory. One of the advantages of a voluntary system is that people work on this because they like it, because they feel it's important. So they might put more effort and more things in answering the data. They might be a little bit more realistic as compared to maybe giving political answers, the wanted answers in a mandatory system. There's something to say for both.
Yeah, yeah. No, well said, and thank you for that. So there are a few more questions in the chat box, but because of time, we have to close the session. But it's been very interesting, and I love the quote from the DEPED director that Johanna shared. As he says, as long as the data is used, it will validate itself. And I think that's a really nice way to close it. I want to thank you, Ibo, for an excellent presentation and really bringing to light and to picture data and data use in the Philippines. So that closes our presentations today. And I would like to give maybe a minute or two to Bella to say a few words as maybe just some reflections. I know you are well abreast with what's happening in this, but maybe you want to just say a few words to close off the session.
Yeah, thank you very, very much. I think it has been an amazing session, super, super interesting. Specifically with all the WinS aspect, how data and using data has been of utmost importance for triggering progress. And I hope this could also inspire countries to use data in the whole way of program steering. I think that's what we could see here. And I was impressed also, specifically Indonesia, fantastic, showing also how dashboard is being used by different government agencies. So I think we had a variety here, and also Cambodia, super interesting how data is being assessed. And I think all this is amazing to see, and I just hope it will inspire others. And I hope also that we will all be able to see where the questions coming from, what are the learnings that those countries who in the process of setting up systems like this will receive help and support. And I think that's something perhaps where the WinS network can play a role, and it would be great forwarding perhaps questions, requests. We could see how we could create a platform for exchange, because that's what it's all about, exchange, learning. Don't make the shortcut and pitfalls some countries had to avoid that, and also show shortcomings. I think that's also something we could all look at, what are shortcomings, to be honest and learn from each other. And thanks a lot. I found this a great presentation, and also congrats to Belinda and the team behind with Fred and March to facilitate this all. I think fantastic, great learning. Thanks a lot. And to the presenters, I think we had great presentations today. Fantastic. Thanks a lot.
Thanks, Bella. Bella, how do you say? I mean, you don't speak what you call Filipino, but how do you say in Tangala? How do you say thank you?
Salamat.
Salamat.
Yeah.
Ah, salamat is beautiful, of course. Salamat then to everybody in in the Philippines. So then, Marge, it's back to you. Thank you very much. I've really enjoyed this session, and I can't say more about all the learnings that we've had. We will try to put everything together in a webinar publication. Many of you who still have questions, please rest assured, we will try to get those questions answered for you, and as well, Marge will share a little bit more about how to get the presentations too. So thank you so much. Thanks, Marge.
Yes, thanks, Belinda. Yeah.
Salamat.
And thank you very much, Bella, for the excellent wrap up, and Belinda for your excellent moderation and for facilitating the lively discussion. Salamat. To all our presenters, thank you so much for the rich and insightful presentations and for sharing the experiences from your country to the broader audience that we have here today. And of course, thank you to all of you here today for tuning in, for sharing your insights, for all the questions, the very rich exchange, and for staying until the end of the session. Just a few housekeeping reminders from my side before I finally let you go. Please bear with me. This will only take 2 to 3 minutes. This session is only the third out of 5 series of monthly webinars, which is being hosted by the WinS Network in line with the mission to foster a global community of practice on WinS to harmonize strategies, as Bella pointed out earlier. And we are looking forward to hosting 2 more sessions in June. And we would be very happy to hear from you on what your thoughts and feedback are on this session that we had today, as this would greatly help improve the upcoming sessions. Here on the screen, we are sharing some of the feedback gathered from the last webinar, which some of you here may have also attended. So we appreciate those who have provided their input, and you may rest assured that we are taking them into consideration. Like we have extended the session from an hour before to 1.5 hours now, and allotted more time for Q&A and exchange as requested by a lot of the participants from the last session. So I hope you felt that we are listening. And on that note, we would therefore like to request you to please take 2 to 3 minutes of your time to respond to the short feedback form, which you may access via the URL or QR code. There you go. And yeah, we'll also place the link in the chat, and it would be greatly would greatly appreciate hearing from all of you. And again, many thanks in advance, and we look forward to seeing you in the next webinars. Please expect to receive an invitation for the upcoming sessions, and we hope to see you again there. Once again, on behalf of the WINS Network Secretariat, thank you very much for your time and attention. Thank you, and enjoy the rest of the day. Bye.
Thanks. Bye-bye.
Thank you, everybody.